This Friday, October 29th, is World Stroke Awareness Day. Strokes have reached epidemic levels in the United States. Frightened statistics compiled by the American Heart Association and the American Stroke Association estimate that there are approximately 800,000 new strokes annually, resulting in approximately 100,000 deaths each year. By the year 2030, 1 in every 25 adults will suffer a stroke, which translates into 3.4 million individuals. Stroke is still the second leading cause of death worldwide, and the third leading cause of disability. This year's worldwide stroke campaign seeks to raise global awareness of the signs and symptoms of a stroke and the critical need to seek medical assistance as soon as possible. The theme of this year's campaign is "Minutes Can Save Lives." In the past, the American Heart Association and the American Stroke Association have developed a saying, "Time is brain." Both of these themes emphasize the need for prompt treatment of strokes to reduce the risk of permanent disability. So why is time so important? Because timely intervention can stop a stroke from progressing, reverse the tragic consequences associated with strokes, and save lives. Minutes can save memories. Minutes can save mobility. Minutes can save speech. And minutes can save independence. There are two major classifications of strokes. The most prevalent type of stroke is known as an ischemic stroke, which is caused by a blood clot within a blood vessel in the brain. This accounts for approximately 85% of all strokes. The second type of stroke is known as a hemorrhagic stroke, which occurs when a blood vessel in the brain bursts or ruptures, restricting the flow of blood within the brain. This event accounts for approximately 15% of strokes. In each type of stroke, the brain is deprived of essential oxygen, which causes the rapid death of brain cells, leading to long-term disability. A stroke is a medical emergency requiring prompt diagnosis and timely treatment. Timely intervention will prevent cell death and lead to a better outcome. The tragic consequences of a stroke can be limited or even reversed if treatment is rapidly instituted. There have been critical advances in medicine to prevent or limit the tragic consequences associated with strokes. There is now a clot-busting drug called TPA, and if administered within hours of a stroke's onset, it can dissolve the blood clot, leading to almost complete, if not total recovery in many patients. Besides this medication, there is a surgical procedure known as a thrombectomy, which mechanically clears the stroke by pulling it out of the brain, and this too is now widely available. This procedure provides additional means for treating a stroke beyond the 4.5 hour time window usually reserved for TPA. Using this surgical treatment in many patients, treatment can take place up to 24 hours after a stroke. The procedure has been nicknamed Mr. Clean. So the quicker one gets to the hospital, the sooner a firm diagnosis can be made, and the sooner prompt intervention and timely treatment can begin, the better the outcome. All hospitals should now have CT scans available to scan the brain to determine if a stroke has occurred. And all hospitals should have the ability to administer TPA. And a neurologist should be available for rapid assessment of the patient. So let's learn the signs and symptoms of a stroke for early and critical recognition, because delays in diagnosis and delays in treatment can have tragic outcomes. The recognized signs and symptoms of a stroke are sudden numbness, tingling, weakness, or loss of movement to the face, arm, or leg, sudden vision changes, sudden speech difficulty, sudden confusion or trouble understanding simple sentences, sudden dizziness or problems walking or balancing, and sudden or severe headaches. The word FAST, F-A-S-T, which stands for facial drooping, arm weakness, speech difficulties, and time, is a useful way of remembering stroke signs and symptoms. When in doubt, get to the emergency department of the nearest hospital. You can't afford to delay. And any friend, relative, neighbor, or coworker who suspects a stroke should call 911 immediately and report their concerns. Fortunately, many hospitals are now designated as stroke centers, and an ambulance will transport the individual to the proper institution for care. In many cities, there are even dedicated stroke ambulances, which can be dispatched if a stroke is suspected. These ambulances can take in onboard CAT scans, transmitting the scan to the hospital electronically and beginning critical medical care even before the person arrives at the emergency department. So remember, every minute counts. Thank you for joining me today on another edition of the Brain Injury Insider. I look forward to speaking to you again next week. Until then, wishing you continued good health and safety.